Dr. Rossignol made his entry into chemistry through the University of Paris, an area that had already established a legacy for medicinal chemistry, starting with Louis Pasteur's creation of the pasteurization process, which allowed scientists to eliminate bacteria in foods that caused them to spoil, as well as improve the overall sanitation process worldwide. France became a hotspot for medical innovation. Pasteur's later research on germ theory, which held the theory that bacteria could be the cause of diseases in the human body, led to the creation of the first vaccines. Dr. R planned to continue in this tradition, receiving his PhD in medicinal chemistry at the University of Paris.
The story of people who think about what the world was before Fleming and Domag. Okay, so the world was, infectious diseases were killing the vast majority of the people dying.
On his first mission to the field, Dr. R traveled to China in order to develop chemotherapy techniques to eliminate schistosomiasis, also known as snail fever.
Schisto is a very debilitating disease. It doesn't kill, that's the problem. It keeps people debilitated for 10 or 15 years, and then they will eventually die from all kind of disease. I was young and very excited. It was very dangerous at that time. Very, very primitive traveling, a few planes, slow trains, no hotels, no running water.
Under the guidance of Dr. Davis, the team was able to find an effective treatment for the disease. Dr. R spent the next 25 years in infectious disease before meeting with Mark Ayers in Florida about starting their own pharmaceutical company.
1987, 1988, the old days of, developing drug for tropical disease or for parasitic diseases was gone. There was no treatment, and the AIDS community was dying from AIDS and crypto, as opportunistic infections, and Remark was created because nobody else wanted to do it.
In December 1993, my friend, Dr. Rossignol, Jean-François, called me and asked to meet and talked about the possibility of putting together a pharmaceutical company. Dr. Rossignol was passionate about the work that he does, in particular about discovering and developing drugs. He's very passionate about doing work in infectious diseases, and I'll never forget him telling me, he said, "This is what I know how to do, and I want to do it, but I need a partner."
We were a great team. All this business is related to personal relationship between people, the way people work together, the way people are, essentially compromising with the problems that you may have. And I think working with Mark, you're a great man for compromising and moving forward a team of people. You have to be able to work with people. You have to be socially, a nice person, okay? And if you're not, it's not going to work.
I mean, we would meet on his back patio or in my dining room. I had children that would crawl around under the tables, while we were working. He took off on airplanes and started traveling around running clinical trials and doing drug development work, and I set about the business of running and building a pharmaceutical company from there. Yeah, so in the beginning, when we sat down, Jean-François said to me, look, I have this drug, and I know that it is effective in treating helminth infections, which are intestinal worms. Worst case, we're going to sell a whole lot of product in South America for treating intestinal parasitic infections, worst case. He says, but I think this product is going to be effective against cryptosporidium.
Cryptosporidiosis, also known as crypto, is a parasitic disease spread through the fecal route, often through contaminated water. The main symptom is self-limiting diarrhea in people with strong immune systems. In people with weak immune systems, symptoms are often fatal.
It was just a broad spectrum antiparasitic, so there was a decent probability that it would work on crypto, but that's serendipity. That's your destiny, okay? The people who discover drug will always tell you that this is their destiny. It was somewhere in their gene, when they're born.
Serendipity, fortunate happenstance, luck leading to innovation, the guiding hand of God. The idea of serendipity is consistently present in scientific innovation and is just as prevalent today as it has been throughout history.
I went immediately to Mali, to test do the first clinical trial. was very, very difficult. There's no question. Someone asked me someday, was it difficult and dangerous? It was very difficult and relatively dangerous. We were concerned about malaria. We were concerned about even the civil unrest, you know.
We did clinical trials with Professor Romero in Mexico, and I know he was treating children, and he would diagnose children with as many as 12 or 13 parasitic infections, all at the same time. So when you can take those children and treat them with a broad spectrum product that wipes out all of those different infections, you've really done something that's very, very special.
They were correct at the end of the day. You know, this is very interesting that the Mexicans were just smarter than we were, because it took, 6 years later to get the US approving the drug. Well, they have already approved the drug, and the drug was available. And if you remember, the people, the AIDS patients, were going to Mexico to buy their medication because they knew that the US would be late.
NTZ was effective in combating crypto, but it took 6 years for it to be passed by the United States. In that time, Dr. Rossignol wanted to see what else NTZ was capable of fighting. This led to tests on its effectiveness on viruses.
There are tens of thousands of people that die every year in the United States from complications associated with influenza. The CDC tells us somewhere up to 50,000 people per year that die with complications. In addition to that, there is this element of fear and discomfort and insecurity that people feel when we're facing threats that we don't know, that we don't understand fully, and that are able to create incredible problems to public health.
We have synthesized new molecule to try to improve the existing molecule, and we did it very successfully.
So our company is on the cutting edge of developing new drugs for treating a broad range of infectious diseases, particularly viral diseases. Historically, we attack viruses or viral diseases by going directly at the virus. Viruses, we all know, evade drugs. They become resistant. Our approach doesn't target the virus directly, and because of the way that our drugs, this class of drugs work, we're not seeing the resistance that you typically see. So you're able to have effect against a broad range of influenza viruses that may, for example, influenza viruses, that may be resistant to other drugs. We submitted our new drug application for Alenia. That was just the first new drug application that we, Romark, had ever submitted. We probably only had 12, 15 employees maximum at that point in time.
It's challenging and it's fun. You risk your life every day. You know, that's the most exciting things you can do. You know, people play bridge or play, whatever, or gambles. This is kind of gamble, because the rate of failure is so big. And you just when you pass, this is where the real pride is. Okay, when you pass, then you know that you've been. When you pass a test, when you pass a clinical trial, you find the results, and you see the results, and when it's better than your wildest dream, So this is really exciting. For that, you have that's the definition of blockbusters. Okay, this is where the blockbuster concept comes from. Okay, so I think that Thiazolide is obviously a blockbuster because it's a broad spectrum antiviral. We need that at the first ever discovered. We need something for that, and so that's really so the company is going to explode, and it will become probably within a year something we will not recognize, from the Cryptosporidium days, and the Manolo Martinez Mexican connection that we had at that time. So that's a success story. Well, perseverance is the key, because you have some real bad times, okay? And we, Romark, in 20 years had very, very bad times, okay? There was time where the very survival of the company was in question. So I think persistence, is something. You have to just believe that, the day will be better tomorrow, and sometimes it is. And in the case of Romark, it was. You just trust the future. and the people around you. This is the most important thing. You have to trust your team. If you don't trust your team, you're gone.
I think people buy into the vision. They see that it's more than a job. It's a privilege and an opportunity to make a difference. We also have today about 150 employees, more than we've ever had, and we're growing. And that number is going to continue to skyrocket, I'm sure, as we move forward over the coming months and years. We deeply appreciate and value the efforts and the trust that those people and their families have placed in us, and we take that very, very seriously. It's a privilege to be able to work in the situation that we do, in the business that we work in, and I think that is something that flows through the people that you'll find, throughout our entire company. We owe 100% of our success over the last 20 years. Indeed, we're here today because there have been a lot of people out there that have believed in us.
So this is medicine progresses very slowly, and your contribution, even if it's a great, is going to be a little dwarf.
What it is that we do, understanding the gravity of it, understanding that the things that we're doing are going to affect potentially billions of people on the one hand, but on the other hand, it may affect our own children, it may affect our spouses, our mothers, our fathers, it may affect us individually. And so there's a lot of responsibility that goes with that, and being able to see that and understand what we're doing and have the integrity to be able to latch on to that and to maintain that kind of a purpose and to work with that kind of an attitude and that kind of an understanding of the gravity of what we do is going to be something that's very, very important.
You're talking about something you're proud of. It's very difficult for us to relate to the number of lives we have saved, or if we really have made a difference, in the world. But when you do the new generation product, when we put an amino acid on the top of and we get a drug totally insoluble, which became soluble, injectable, and we know it's going to be, 10 times more effective. That is really a great satisfaction.
We have the opportunity to make a difference in the lives of a lot of people.
It was an adventure, okay? It was an adventure, and it's been highly successful.